Ladies and gentlemen, the COVID-19 pandemic has overstretched health systems globally and presented risks of increased burden of other major infectious diseases, especially in low and middle-income countries. The containment measures put in place have also affected delivery of key services in these areas. One such key service is management of malaria. Today's theme, therefore, focuses on malaria. Interaction, if any, between COVID-19 and malaria in terms of clinical outcomes is currently poorly understood. What is clear, however, is that symptoms of the two diseases are quite similar, and this can present diagnostic and clinical management problems, especially when diagnostic capabilities are limited. The malaria symptoms are similar to those of COVID, that is fever, weak joints, lack of appetite, among others. The majority of our people have been getting these symptoms and may be suffering from malaria, but have shied away from visiting health facilities. They are only forced to seek medical attention once their situation worsens, and this has posed great danger to their health. The National Malaria Program in the Ministry of Health is charged with the responsibility of coordinating all efforts to prevent, diagnose, control, and eliminate malaria in the country. The program brings together all stakeholders involved in the fight against malaria and seeks to ensure that resources in this fight from both domestic and foreign sources are deployed effectively and efficiently. The program's strategic work focuses on both prevention and treatment of malaria. In prevention, its activities center around providing access to and distributing long-lasting insecticide-treated nets, indoor residual spraying in some of the endemic counties, and prevention of malaria in pregnancy. In treatment, it provides anti-malarial drugs and trains healthcare workers on clinical management as well as diagnosis of malaria. The National Malaria Program works with various partners to procure life-saving commodities such as insecticide-treated nets, anti-malarial drugs, and diagnostic reagents and kits. According to data from the National Malaria Program, about 5 million people are treated for malaria each year in Kenya. Our health facilities have been treating about 300,000 people every week for malaria. However, since the COVID-19 pandemic struck, we have noted that the number of people receiving treatment for malaria in our health facilities has dropped to about 100,000 per week. And this, of course, is not something that we want to continue. This needs to be corrected, and we need to be able to get people to visit facilities anytime that they feel they have symptoms that might indicate that they have malaria. Why is it that we are seeing this drop? Our medical research experts attribute this drastic drop to the fact that majority of those who develop malaria symptoms prefer to go and self-medicate themselves during this pandemic time by purchasing drugs from chemists. In fact, there have been a couple of publications from other countries that have shown that during this pandemic time, there has been self-medication or over-self-medication for malaria. Other reasons could be the fear of being tested for COVID-19. Remember that the symptoms are similar, so people might fear that if they go to a facility, they will be tested for COVID-19, and you know all the other issues around the stigmatization of this disease. While another reason could be that people actually fear visiting health facilities because they think they might contract COVID-19 from these facilities. We want to say that all these are not founded on any fact, and there is no need for those who require medical services to have fear of any nature, to be able to present themselves to get treatment at the right time so that they can save their lives. All these are very misinformed notions because regrettably, majority of those with malaria who fail to seek proper medication in good time when the disease is still mild end up doing so when they have severe malaria. This could complicate their health status, as it is likely that some may lose their lives if they do not get the proper medical attention. It is for this reason that we are today appealing to our fellow Kenyans that whenever one develops malaria-like symptoms, they should present themselves for medical attention at the nearest health facility instead of self-medicating or shying away from visiting health facilities. Failure to do this could lead to severe malaria, which can lead to death. Severe malaria is caused by delayed diagnosis of malaria, late seeking of treatment, wrong treatment of mild malaria, as well as resistance to first line of anti-malarial drugs. Today, we are pleased to inform you that we have with us here representatives of Fosun Pharma of China who are donating an anti-malarial drug to the ministry. The fact that we are receiving this donation does not in any way indicate that we have a shortage of anti-malarial drugs. Far from it. In fact, our health facilities have all the commodities we need to treat our people for malaria. However, we do accept any donation coming from well-wishers that satisfy our requirements of quality and standard and that boost our supply lines. The drug that is being donated is artesunate injection, 60 milligram, for treatment of severe malaria, which is a life-threatening condition. The pharmaceutical company making the donation is qualified by the World Health Organization as they meet the high standards of manufacturing and quality required by this international organization. The donation that we shall be receiving consists of 400,000 vials of the injectable drug valued at about 73 million Kenya shillings. This quantity of drug can treat about 70,000 patients with severe malaria. In 2019, the country reported 250,000 cases of severe malaria treated with artesunate in the public sector. And of these, 75% of those being treated tend to be children under the age of 15 years. So this donation is really going to boost the stocks that we already have and will contribute greatly to the treatment of severe malaria, especially in children. It will go a long way in helping us to buffer our stocks for persons who need this drug. After I finish my statement, I will introduce the donors, and we shall move over to the desk there to have that ceremonial handover of the donation. But now, fellow Kenyans, let me move to our COVID-19 statistics for today. Today, we have 246 people who have tested positive for COVID-19 following testing of 4,149 samples over the last 24 hours. Our cumulative number of confirmed cases now stands at 32,803. And the cumulative number of tests that we have conducted thus far stands at 429,513. All of the 246 cases that we are reporting today, positive cases, 5 of them are foreigners, the rest are Kenyans. 170 are males, 76 are females. The youngest is a 2-year-old, the oldest is 77. Nairobi still leads with the total number of cases over the last 24 hours at 75, followed by Kiambu, 28, Kisumu, 18, Machakos, 16, Garissa, 13, Lamu, 10, Migori, 9, Turkana, 9, Uasin Gishu, 8, Mombasa, 7, Taita Taveta, 7, Nyeri, 6, Kilifi, 5, Muranga, 4, Laikipia and Kitui, 4 each, Kajiado and Kwale, 3 each, Makueni, Embu, Nakuru, Nandi, and Baringo, 2 each, and Bungoma, Busia, Kakamega, Nyamira, Tana River, Isiolo, and Tharaka Nithi, 1 case each. The 75 cases in Nairobi come from Kasarani, 8, Embakasi South, Makadara, and Westlands, 7 cases each, Embakasi East and Kamkunji, 6 cases each, Dagoretti North, Dagoretti South, Embakasi West, Kibra, and Langata, 4 cases each, Madare and Waraka, 3 cases each, Embakasi North, Roysambu, Starehe, and Embakasi Central, 2 cases each. In Kiambu, the 28 cases are from Thika, 15, Kiambu, 6, Kikuyu, 9, Githunguri, and Kiamba, 1 case each. The breakdown for the other counties, you'll be able to get it from the document once you receive it. I'm also happy to note today that 160 patients have recovered from the disease. 120 of them have been released from home-based care program, and 34 have been discharged from the various health facilities that they have been receiving care. The total number of recoveries now stands at 19,055. And again, we appreciate and send our appreciation to our healthcare workers for taking us to these milestones. Unfortunately, we have also lost 5 patients to the disease, bringing our fatality to 559. Our sincere condolences to the families and friends of all of those who have lost their loved ones throughout this pandemic period. Thank you. The Fossum Pharma Company, together with his colleague Mr. Wilson, and they're here to participate in the handing over of the donation, but we shall come to that when we finish this question and answer session. So, Mutua.
My name is Raquel Muigai from Citizen TV. It would be good to just understand the status of the UHC in the country, given that it plays a part in the strike that we have in among medical doctors, because some of the counties say that, especially the pilot counties, the money that was supposed to be disbursed to them was not disbursed, and therefore they employed a lot of health workers during that period, and these counties did not receive the amount that was promised to them.
Naima Sampao from NTV. Yesterday you said that there is no reagents and that's why the numbers are low. Could the lack of reagents be linked to the money that has been lost in KEMSA?
Sada Hassan, KTN News. Is there a system whereby we can be able to, a system that, or a database that we can share with the public that can show distribution of PPEs across hospitals in the country? Because you keep on saying that PPEs have been distributed, but doctors keep on saying they do not have these PPEs. And then the second question is, today World Health Organization will announce Africa region as polio-free. As a ministry, are there measures that you've put in place to ensure that moving forward, once we have been declared polio-free, we will not go back to that situation? Thank you.
Ujambo katibu, naitwa Boni kutoka Euro TV. Ningependa kusema ukweli, tuambie hivi, kwa mtazamo wako hivi, unaona kama nchi tumepiga hatua dhabiti ya kufungua mashule tena bandani huu mwaka?
Okay.
Good afternoon. My name is Agri Omboki from the Daily Nation newspaper. My question relates to the circular that was sent to by universities to medical students to prepare for exams. We have received complaints that some of these universities have not actually, the students have not completed their coursework. And here they are being compelled to go and do exams with some course units yet to be completed. In your view, will that have a negative, will it have an impact on the quality of medical practitioners coming out of these universities, or is it something that the missing parts of that coursework will be covered after they graduate as medical practitioners? Kindly comment on that. Thank you.
Okay. Thank you. Thank you. Regarding the status of universal health coverage and the activities that the ministry is rolling down together with the counties on the UHC journey, I want to tell you that that process has been ongoing for the past more than 2 years. As you know, we ran through a pilot for 1 year in 4 counties, and based on the lessons we learned from that pilot, we have scaled up to all the 47 counties. The agenda is still on, the activities are on. However, I think there may have been challenges because of the COVID-19 pandemic and the response to the COVID-19 pandemic. As you will agree with me, that the measures that have been put in place to contain this pandemic have disrupted many activities, including in certain cases some of the activities that we are rolling down under UHC. However, I think that if anything, that this pandemic, any silver lining that it may have under that dark cloud, is that it has allowed us an opportunity to accelerate the efforts of strengthening our health systems, which was the fundamental aim of UHC, is at the primary level to be able to build up primary health care and to strengthen our health systems. This pandemic has provided us an opportunity now to be able to actually do that. And the fact that we are putting in resources related to COVID in health system strengthening is also, enhancing our work in the area of UHC. If you say funds have not been received by some counties, funds that were earmarked for them for the UHC, I'm not aware of that information, but if indeed such information is there, we will need to look at that and see which particular funds are we referring to here. You indicated that this may be funds that were meant to pay healthcare workers. I do not have the facts on hand as to which funds might have been affected in the UHC program because of the COVID-19, but we might be able to respond to you at a later date on that. The second question was regarding the lower level of testing that we are carrying out now, and whether that is linked in any way to what we have been seeing in the media regarding COVID-19 funds. I want to say that this is not the first time that we have experienced breaks in the supply chain of these reagents for testing. We have in the past told you here when we have constraints in that area and the reasons why. The reasons are very clear. These commodities for testing are rather scarce and they are in high demand globally. So that supply chain is not very stable. We have done all we can, even working with manufacturers in those countries where they manufacture these products, to try to get special quotas from them to ensure a steady supply chain. What we are experiencing now is a temporary break in that supply chain, where we have not received the consignments that we anticipated in this month of August, early in August, but that consignment will soon arrive and we should be able to go up to the previous numbers that we had. So in terms of interruption of this supply chain, has nothing to do with some of the things we are reading in the media, because we already have entered into arrangements way before with the suppliers of these reagents to provide us with these reagents on a scheduled basis. Sometimes they may not be able at a certain point in time to meet that schedule, and that's the kind of situation we are in now. But I think in the next week or so, we should be able to overcome that problem. Whether we have a list of PPEs and other products that we have distributed to health facilities, I'm sure that the team here is able to compile that kind of information for your consumption, and we can charge the team here to be able to provide that information for the media. The polio, the WHO TC going on today declaring Kenya declared a polio-free country. We're proud to be at that level again. If you recall, we were polio-free for quite a while, and the reason that we lost that status of polio-free is because of one case that was detected in Eastleigh, but originated in a refugee camp across from on our border with Somalia. And we have responded to that very vigorously since that case was reported, and that is why you see today we have been able to regain that status. And of course it is our intention as a ministry to continue to maintain that status. Schools opening. There is discussion around opening of schools, as you know very well. And that is an area that requires wide consultation and discussion, because education is a different sector. There are many sectors that will need to meet and discuss this. Protocols have also to be developed, if indeed that is to happen. And I can tell you that these discussions are ongoing. Hopefully we will be getting some direction or decision on what is going to be done, not only in the area of schools, but some of the other containment measures that are in place. Remember that we are now approaching almost the 1-month extension of the curfew, so we expect that the head of state should be making a statement that will address some of these issues very shortly. Regarding the medical students who you say have been recalled to come and sit their exams, for us as a ministry, I think our major concern is whether that kind of environment would be contrary to the measures that we have put in place. So as a ministry, ours is to work with the Ministry of Education and to be able to lay down the proper protocols that will ensure that, one, we adhere to the restrictions that we have put in place to minimize the risk of transmission. That is a primary concern in this public health response as far as that is concerned. Of course, the quality of education that we get of our students is also of concern, but really that is under the mandate of the Ministry of Education and some of our regulatory institutions. But I cannot comment on that because I do not know the circumstances that you state that students who have not completed their coursework have been recalled to do an exam. We don't have that information. That information has not been shared with us. So at this point, we are looking at it from the public health concern point of view. I think that addresses the questions that have been posed to me, and I want to thank you. So now we would like to proceed and receive ceremonially the donation that has been presented to us. 73 million Kenya shilling donation is not a small donation. And I want to take this opportunity to thank Fosun Pharma and their representatives for this very large donation of a very important drug that we use in the treatment of malaria. And we will continue to work with those well-wishers who present us with offers of donation, as long as we are satisfied that the donations that we are getting are products that we will use in our system and that meet our required standards of quality. We welcome well-wishers who want to support us in this fight against COVID-19, but also in supporting our other health activities, such as malaria that we have. We are receiving a donation for today. Allow me then to just give an opportunity to my colleague here to say one or two words about this donation.